Yeah, just a quick story about my background. So I'm a scientist by training. So I came to US 25 years ago. I was a postdoc at the biomedical school here in New York, Rockefeller University. And so I'm in venture capital and family office business for the last 17 years. So my first fund was a corporate VC. So it was a multi-billion dollar fund. So after that, I started a family office venture capital fund. We invested in early stage biotech companies here in the US. Most of them were from Boston area, not surprisingly, and we syndicated a lot of deals with other venture capital funds. So my next fund was a corporate fund. So again, I'm just talking about family offices and corporate VC here. So it was like a different dynamic. It was a little bit boring to the point that we had 1 billion under management, I would say, and then our CEO would correct me, say like, you cannot say that. I said like, why? We only have like 990 million under management. So you should say almost. So everything was like really structured and regulated. So after that, I just, so I've been at the corporate VC for 3 years, and as of this year, I'm back with family office venture capital. And we are invested in companies that relate to aging. I'm happy to answer any
Okay.
other
What about the
questions.
Moderna?
Well,
Because
that
you
was
remember
a
you
part
invested
of
in Moderna.
my fund when I was part of the family office. So we invested it a long time ago. So again, as you know, most of those companies when they start, they are very small. So like so it's not
Like a startup.
they're all startups. Essentially, you have less than 5 people working for them, and then some of them grow into multi-billion-dollar assets, and some of them fail. But that's part of the game.
Okay. And Emily.
Hi, my name is Emily Luskind. I started my career in investment research at Morningstar with a focus on quantitative ESG research. And after completing my master's in data science, I co founded a company called Good Data Hub. My team is myself and two Black African founders, so we are the most diverse and underrepresented group that you'll see in the AI space. Our solution helps companies reduce their AI risk exposure and enable them to deliver compliant and responsible AI solutions. So I work with partners in biopharma, energy, and financial services. And what we've discovered is that there's a lot of work being done at the strategic level for responsible AI, but not so much at the operational level. So there are platforms that exist for AI governance, but there was an absence of responsible AI tools that directly integrate into developer workflows. So some of our partners include leaders of the boards of data and AI ethics at our respective partners, and they spend a lot of time establishing responsible and ethical AI principles, but that doesn't guarantee that those are implemented in practice, thus the need for a tool that directly integrates into developer workflows.
Yes, and my first question, there is a next big thing in aging, beauty, and plus biotech. And what do you think, like because, it was our conversation before about the Kiki world, and it's new business models coming too, and there is a 10x for specifically for these industries, because Emily, she knew about the L'Oreal and Estee Lauder too. It's probably should be the next, like the Estee Lauder 3, no, like a 0, something like this. Yeah, and how? Let's start with you.
Well, again, for me, like the next big thing, and I don't want to steal the next AI panel. So, but yes, AI is actually coming to biotech. So, the next big thing for biotech would be quantum computing. So, it is. I should be talking about new like biological pathways and chemistry and molecules probably. That it could take all day, but I think fundamentally what we are going to look at new way we actually will be understanding how human biology works. And then, so to run those models on old-fashioned computers, silicon chips is kind of, we're limited, I guess, in the processing power. But once the quantum computing become available, I mean, it is already available. You can rent IBM quantum computer for your own things. Then I think we will be at the next level of understanding how human biology works. We can look at all of the proteins, all the molecules, not just one by one, but how the whole system holistically works. And that also will be applicable to aging process, because as we know, aging is not a disease. We all age, we all born, we all mature, and we all die. So, and then why it is happening, how it is happening, and what can be changed in the process of, from being born to the death. I think that quantum computing will help us, and AI will help us to understand those pathways, and hopefully we'll create something to affect those pathways so we live longer, happier, and healthier lives.
Just statistically, it's projected that over the upcoming decade, pharmaceutical companies will spend $50 billion a year on AI to propel every stage of drug development. But the areas that I'm particularly interested in, I think there's investment opportunities here are in responsible adoption of technology that is AI and bio enabled. So two areas of focus would be healthcare equity and cyber biosecurity. Technology has the opportunity to make healthcare outcomes more equitable. However, we need to be very careful of biases in the data. So data governance is essential here. Particular areas would be rural medicine, and that would be both domestically and globally. So in rural areas in the United States, there's a huge gap of physicians available, and technology will allow those communities to have access to healthcare. And as it relates to cyber biosecurity, which is the intersection between biology, biosecurity, and cybersecurity, that's going to be a growing concern for companies as they increasingly need to protect against threats to their biotech ecosystem. And one example of this would be with wearable tech. So I think that consumers will make their decisions of the quality of safety with their wearable tech. To increase adoption of your technology, you must be focused on user safety.
What is your personal challenge right now, and what is the best use cases and probably benchmark how the guys from the family offices, specifically in the healthcare beauty, for example, I'm saying Jane is still out there, right? She's like a $2 billion actually girl, and she can invest to you and be a GP in different funds too. What is your personal challenge, and plus what is the best use cases, than the family offices and venture capital?
Well, again, I'm more on the biotech side, right? So we are trying to sort of grow the beauty within your body,
it's not about
inside
the
out.
beauty. It can be
but also
hygiene,
it relates to the question: what are the challenges? Because it's actually costs much more to develop a drug than as cosmetic thing, right? So different people say different numbers, but they said it could be up to $3 billion. You have to invest in a drug from the discovery process to the drug it's being approved. And that's actually, again, no guarantee if actually going to be a commercially successful product at that point. So family offices cannot really invest in one product themselves, so they have to really syndicate deals with venture capital folks and then with corporate VCs, big pharma guys. So you have to come up maybe with not with $3 billion, but in the range of hundreds of millions of dollars could be easily spent. Of course, there's a huge upside as well because you have IP protections, not just the marketing. It's something that you could benefit from. But you definitely you have to rely on your family office, on your own strength at the beginning of the process, and then you have to have great relationship with venture capital guys and corporate guys to make sure that you can actually not just conceive your idea, but first of all bring the company through next inflection points, maybe bring the company public, but yet you have to finance the clinical trial development. I think that's, again, it's not really a challenge, it's just the way we work in this space. So on the cosmetics, again, I don't really have so much experience, but my brief experience in this space, we worked on functional medicine products and cosmeceuticals at one of our companies. We invested and that marketing is a key. So if you do like B2C, it's very hard. Even B2B is very hard. So something that you have to have a separate sets of skills, and then you might also want to work with guys like L'Oreal, Nestle, and so on.
Mm-hmm. Emily, what's going on with good data, like because regulation coming to you, probably it's going to be challenging risk factor to you, and how it's going to be for the privacy data and new business models, and probably how the new generation of Gen Z and investors and actually go to the and make the money on that.
So the European Union has officially adopted the EU AI Act, which will apply to organizations that are both domiciled and that operate in the EU. And the first step of that is removing any AI systems that are designated as like too high risk, meaning that in the EU you can absolutely not use them. And I think the adoption and implementation of responsible AI is two-pronged in biotech, given that they're using different models and there's different risk factors when you're both doing like sales and marketing versus doing drug research. So for the drug research, it's the risks that you're concerned about are patient-specific risks, and with marketing and sales, it's more like business and financial risks. And so they're going to have to be, establishing principles and making and across both parts of their business, and that will be the next challenge for them to do. And additionally, in the United States, the FTC and the SEC have implemented some AI regulation. The US is taking a different approach than the EU. So instead of having some overarching legislation, they're sort of adopting it into existing frameworks. I don't believe that those will have any teeth in terms of legal liability for organizations. However, a lot of states are implementing AI-specific legislation, and also the state of Washington just enacted a health data-specific legislation. So companies are going to have to be, more cognizant and follow those guidelines.
Okay, guys, thank you so much. If you have questions, please let us know. Yeah.
Yeah. Hi, I'm Jason. I have experience both as an investor and also as a founder and operator in biotech and AI biotech. I've observed that the new wave of investment for the last 10 years or so, 5-10 years, in tech-enabled or AI biotech often comes from a very different pool of capital and investors in traditional biotech world, which I work in the past. And I'm curious to see what you're observing there. And one of the issues that I've noticed is that the two worlds have very different philosophies and kind of strengths in understanding what drives value. For example, in the biotech world, it's very asset-focused, drug-focused. In the tech world, it's about how do you enable technologies using AI, et cetera. Do you see cross-pollination between those two kind of camps? And how do we get investors, allocators to really start communicating and sharing ideas?
And plus IPO too. Yeah, you have a bunch of the IPOs.
Yeah, I mean, you're absolutely right. Things are changing. As I just mentioned, that quantum computing, for instance, coming in a mainframe, how we look how, let's say, proteins, it's a bricks of our body made, so how they folded. It used to take you 5 years to look at the protein structure of one protein, and 5 years for PhD folks to work on it. And then now you can do it within 10 minutes. Like AlphaFold, this is the biggest program that looks at the protein structures. Works faster. AlphaFold 2 using now AI tools. So the traditional AlphaFold still use computational tools, which are more traditional. AlphaFold 2 uses AI algorithm. Now AlphaFold 3 will come. It's going to be sort of, you can look at all of the in silico design of the proteins and see how they interact with each other. So I spoke to my colleagues 3 days ago I'm a club member of Cambridge Oxford folks, and his PhD, he's in physics and he does AI and quantum computing. and that's what they do. They apply their knowledge for the biological molecules. So he doesn't know anything about molecular biology or biochemistry, but the computational skills that he is bringing to the story is really valuable at this point. So, yeah, I think it's going to take mathematicians, like guys with PhD in physics, not just chemists and biologists, to design new generation of drugs and therapeutics. So that's, for us, it's a fascinating skill. It makes our job so much easier, I would say, and cheaper. So we don't need to hopefully wait for another 10 years and spend $3 billion to get drug invented and approved. I think we can really accelerate it in the future.
Yeah, and you can move this question to one of our speakers. They invest in Neuralink. Yeah, let's move to the next panel. Thank you, guys. Yeah, and I want to invite the guys for the AI panel. Yeah, that's Jeff.